Welcome to US Life Notes. I'm Fiona. Today we have a very special guest, a good friend of mine, Mindy Cheng, who is a board-certified physician specialized in emergency medicine. We will be talking about the impact of COVID-19 in the hospital in today's episode. Hi, Mindy. Thanks for coming.
Hi, Fiona. Thanks for having me on your show. I'm very excited to be here.
Okay. Can you start by telling our listeners a little bit about yourself?
Yeah. So I came from Taiwan when I was 5. So I started kindergarten, and we moved to Torrance, where I spent all my childhood there. So my parents, they own an international business, and originally they wanted to expand to the US, but it actually didn't work out.
Okay.
Even then, they still felt that it was very important for me and my brothers to grow up in the US. But that meant that they missed a lot of our childhood because they still had to go back to Taiwan a lot to work. So I did feel like I missed out on that part. But Torrance had a lot of Taiwanese families that were very similar to ours. And so I felt like there were a lot of kids around me that were in the same situation. So I did a lot of what they did too. I went to Chinese school on Saturdays. I took SAT classes. I played some sports. I did what was needed to get into a good college. So then I ended up going to UCLA for college. And then after that, I went to med school. And then I went to physician training. It's called residency. So I did that for 3 years in emergency medicine. And then since then, I graduated and I've been working for a little bit of time now.
I see. Okay, so let's get started with our main topic for today, COVID-19. So what were your thoughts when you first heard of COVID-19? Probably like last December?
Yeah. So we're going to be talking a lot about COVID-19 today, and I just want to make it clear that these are my own opinions.
Of
they
course.
don't reflect that of the medical community in general or any of the hospitals I work at, or even the American population in general. So last December, January, when, we really started talking about COVID-19, we were in the midst of flu season, and it was a pretty serious one. It impacted the pediatric population a lot. And so we were just so into it that we really couldn't worry about COVID.
Did people get confused about the flu and COVID symptoms at that time?
Yeah, they share a lot of the same symptoms. But we weren't even thinking about whether these people that were coming in were even possibly having COVID or not. We're just trying to survive this flu season.
So are you currently working in the ER right now? How's the situation in the ER?
Yeah, so I think this is hard for a lot of foreigners to understand, is that in the US, first of all, I train specifically in emergency medicine, so I only work in the emergency room. Since graduating, I have been working, but I never work full-time because I have 2 kids at home. And my husband also works full-time. So even though I don't work that much in the ER, I would say 50 to 75% full-time. Right now, we're seeing a lot of COVID patients. So we consider this the second wave of COVID. So the first wave was sort of almost near the end of flu season. There were a lot of people that were concerned that they had COVID. So they would just come in and we would test them. And there was a lot of issues with the testing because there wasn't that much to use. And so we would send a lot of these patients home. But if they had breathing issues, then of course we would keep them in the hospital. And then we kind of died down just a little bit. And then suddenly we saw an increase again where a lot of people that were coming in already knew they had COVID. They had already been tested, knew they were positive, but still because of how much trouble they were having breathing or and just with their health, they were coming in and still needed to stay in the hospital.
So what are the symptoms have you seen?
There's so many symptoms. Obviously classically fever, difficulty breathing. I've had some friends actually that had the loss of taste and smell.
Mm.
But then I had like really old people that came into my ER and they just had poor appetite. And so that's the biggest problem, right? Is that it comes with a variety of symptoms, but these symptoms you can see in so many other diseases
Mhm.
that when they first present to the ER, we really don't know. And because we know COVID is so prevalent right now, we just have to pretty much swab everybody.
So now we have drive-through testing. Under what condition would you recommend us to have tested?
Well, now that we have so much testing, test kits, and you can get it done pretty much anywhere, I would just recommend anytime you feel that you may have been exposed or any symptoms that you should just go ahead and get tested because it's very likely now that you could potentially have it. Whereas I would say a couple months ago when it wasn't so prevalent in the population,
Mhm.
we didn't have testing material that we were really strict with who gets tested and who doesn't.
Have any of your hospital experienced the PPE shortage?
No, not to the extent that some other hospitals have. Or we had learned a lot from what happened in New York City in particular. And
Mhm.
so when that started happening, a lot of the hospitals, including the ones that I work at, started to either try to accumulate more supply or they started trying to figure out how they can save it. So one of the ways, of course, is to restrict when the employees get to use it. Like, for example, before I could probably find multiple areas in the ER where I could find a box of N95 or procedural face masks.
Mhm.
But now they've kind of collected all that supply and somebody is essentially watching it. Somebody is
Mhm.
passing it out every shift. And then some hospitals are doing a process where they re-sterilize it somehow.
Oh, does it
That's
work if you re-sterilize it?
It's been shown to work, um,
Oh.
but I don't know the details to that. I know one of the hospitals I work at, you like put it in a brown bag and then you put it in a box at the end of your shift. And
Mhm.
then the next time you come in, there's like this section in the ER where all the bags is like alphabetized, and then you can like find your bag and
Oh,
read.
so if it's re-sterilized, it's only for the same person to
Yeah,
use.
yeah, yeah,
Oh,
yeah,
okay.
yeah. But because also the issue is that we get fit tested for these. So I actually did it today.
Okay.
You wear this really big hood and then they spray special material and then you see if you taste it, right?
Uh-huh.
And then you wear the mask and they spray it again to see if you taste it. If you taste it, that means the mask failed because somehow
It can go
the
through.
stuff got through the mask.
Okay.
So I was tested for 4 different masks and I passed one.
Oh,
Yeah.
okay. Interesting. And what about the negative pressure rooms? Do your hospital have enough?
This is a really difficult question to answer, and I probably don't know all the details, but the ER itself has several individual rooms, but then it has sections of beds
Mhm.
that aren't contained. And you can convert the individual rooms into negative pressure rooms, and they have done some of that. But every day the ER gets full, and so you have to work on like who you really think needs those negative pressure rooms.
So
Because
not
at
all
that
COVID
point,
cases.
yeah, because at that point you don't necessarily know if they have COVID or not. You just suspect it.
So for the suspected cases, they just stay in the open area?
No, they actually stay in the room. But then you
Okay.
have other people still coming in with like trouble breathing, and you're not sure if those people have COVID. And so the biggest problem is on a daily basis is using those select few negative pressure rooms in the ER. And then if you know you're going to admit the patients already, then it becomes a hospital issue where you admit the patient to the hospital and there are currently units
Mhm.
floors of like suspected COVID or COVID positive where there's a lot of negative pressure rooms. those rooms used to be normal rooms, but they've been able to convert them. So let's say the hospital has like over 200 something rooms, and they probably vary from 1 to 2 patient rooms.
Mhm.
It's really easy to convert those into negative pressure rooms. And there's maybe, let's say you have a hospital of like over 200 rooms, right? But then in the ER, you only have like 30 beds total. Maybe 15 of them are single rooms. So it makes it difficult to plan it out when you constantly have patients flowing in, how to use these 15 rooms efficiently.
What about those patients that have symptoms and are suspected as COVID-19 cases?
Yeah. We have to assume that they have COVID until their test is negative.
Oh, okay. But what if it's positive, but they're not that severe to be hospitalized?
Those patients go home, and then we give them strict, quarantine instructions.
So your hospital is not that busy. Sounds like it.
So
Well,
besides the fact that the ER um, having to deal with the flow and to most efficiently use your rooms properly, and then the hospital having enough rooms to manage all the ones that need to stay in the hospital, we're not as busy as how it was in New York City, where the ambulances had nowhere to bring patients essentially. So the hospital can get busy enough where we say, no, we cannot at this time take any patients by ambulance, and we pretty much call them on the radio, and they will instead divert and go to another hospital.
oh, okay.
So we haven't gotten to that point. But then there's a whole nother level where like an entire area of all the regional hospitals are so busy that they can't take any more patients. We haven't gotten that bad.
Oh, okay. That's good. So speaking from the physician's perspective, why do you think people in the United States are not willing to wear masks, especially in the beginning? This is, in fact, one of the most common questions people from Taiwan ask me.
Well, just mask wearing is not a part of American culture. Um, so in almost any scenario in Asia, particularly in Taiwan, because I have experience with being in Taiwan. Like when you see someone wear a face mask, no one thinks twice about it. Nobody thinks that's weird.
Mm-hmm.
Nobody turns around and is like, "Oh, why are you wearing a mask? Is there something wrong with you? Is there something wrong with me?" Whereas in the U.S., people see someone wearing a mask and it's just like very abnormal behavior. Even in the healthcare setting, it really used to be only used when there's a procedure to be done, or the patient is known immunocompromised, or there's very, very high suspicion for highly transmittable disease. Even with the seasonal flu, we didn't wear masks around patients.
Is that the rule by the hospital, or it's just the general things that you don't do?
It's pretty much just that was the standard. We just didn't do that. And I'm sure I have gotten the flu that way by being at work and
Yeah, of
so
course.
but so before COVID, there would be days at work that I never wore a mask.
But are you allowed to wear masks if you want to?
So I am allowed to. Nobody in the hospital will say you can't wear one. But I really felt like some patients would have looked at me like I was being weird. And now I always wear a mask, obviously.
Yeah.
In fact, I wear a mask, and then I also wear goggles. And I also wear a scrub cap. So
Oh, okay.
people can't even really recognize me.
Because I have a friend who's a nurse working in a hospital, and she said that they're not allowed to wear masks before COVID unless the patient, as the one you described, like immunocompromised or like transmitted disease.
Yeah.
Yeah. So they think that is not as respectful
Yes,
to patients
I agree.
or means that you're sick.
Yes,
So that's what they think in the hospital. That's why she didn't wear masks at the beginning.
I agree with that. I think that a lot of times before COVID, if you were to wear a mask, people thought you were being rude.
Yeah. This is weird because actually masks is like both way protections for you and others.
Yes. And a lot of people don't understand that concept, actually. So some people think, so if they wear a mask, it's to protect yourself. And so if they see me wear a mask, they think that I think there's something wrong with them. Does that make sense?
Yeah. I mean, it's interesting, but yeah.
So the other thing is when somebody is wearing a mask, like when an American is wearing a mask, I think they feel stifled, like they're, because like the US, the like freedom is a big deal, right?
Yeah.
And so whenever there's something that threatens that, they're like very against it. And sometimes it seems like, oh, you're controlling my behavior, maybe on a more conceptual level. You're stifling my freedom to speak when you make me cover my mask. Okay, cover my mouth with a mask.
What if we make it more like a common sense to tell them that it's actually protect yourself and others, not as the rules that you have to wear masks? Would that be better?
Yeah, I think it would be more easily accepting. I think that obviously, I mean, the way you present a change in behavior, like you're asking somebody to do something, right? Like, of course, the way you present it is going to affect whether they're compliant or not. I mean, if you make it a threatening issue, like, oh, you better do it or else, then of course they're going to be like, don't tell me what to do.
Yeah.
I don't want to be threatened.
Yeah.
I mean, that's on like all levels. It's not just a mass thing.
Yeah.
I think just human behavior.
Yeah, that's the thing I want to ask because, like, so far we have almost 5,000 new cases every day in Los Angeles. So, what would you recommend us to do to alleviate this situation besides what we already know? Washing hands, wearing masks. Like, what can we do to promote the concept of hygiene in our daily life?
I don't think I can offer or suggest anything else. I think that we really just have to do it and we have to believe that it's going to help. And we shouldn't have to wait till it actually affects us in some way. Like, if only do it if somebody I know ends up getting COVID, or, somebody I know actually dies from COVID. Just because it's not personally affecting you doesn't mean that it's not actually happening and it's not actually serious. Obviously mask wearing is a very new behavior to expect of the US population. So you really have to make a conscious effort for it to become a part of what's considered normal now. But no, the number one thing by far is hand washing and not touching, like your mouth, your eyes.
Yeah, that's the one I'm saying. Like, how can we do to promote this concept in our education, maybe?
Yeah, I mean, this is probably more of a public health issue, but continue to promote it. And I think it's also hard in the US because, here you don't really see people pointing out stuff. If I saw somebody not wearing a mask, I wouldn't say, oh, you should put a mask on. But I remember one time in Taiwan, I was in a taxi cab and it's like summertime. So it was like really hot and then I was getting in and then the AC was like full blast and my nose got kind of runny. And I think I sneezed or something. And the taxi cab driver was like, oh, if you're sick, you should wear a mask. And I was like, oh. I was a little bit startled that he would say something like that because I would never hear that. I would never, can't imagine anybody ever saying that to me. I think people should consider remarks like this like more as advice and encouragement and not as, oh, you're doing the wrong thing. But if everybody does it, then, we can get past this together.
Yeah. Well, because I'm thinking, because in Taiwan, we always have this concept that they promote this concept since like elementary school. So the kids, they know they have to wash hands before eating or like before touching their face or something. This one is getting more acceptable in the community. So like for here, do they have things like like a community meeting for some public health.
That doesn't sound familiar, but you're saying that when you were growing up in school, you would be taught to wash your hands and such?
It's like a very basic common sense. Wash hands.
It's common sense, but were you actually like encouraged by the teacher to do that and such?
Encouraged? I
Yeah,
think so.
because I for sure was not in the US. Like, I don't recall at any point in grade school or in elementary school that I was ever told or saw a teacher ever tell another kid to go wash their hands, to wipe your mouth.
Or is it more like a kindergarten thing?
I don't remember doing that either.
Oh, really? We had to line up to wash hands before lunchtime.
No, we never did that.
Oh,
We never we never did that like as a collective group where it was just like, oh, it's lunchtime. Okay, everybody go to lunch.
I see. So that's a really like a cultural difference.
Yeah.
Interesting.
And I think that's because it's probably more that aspect is that sort of behavior is left for the parents to teach. I would say the school system doesn't accommodate that. Like, I remember when I was in school, it's not like there was a bathroom close by the lunch area.
What?
Yeah, the bathroom is always like where the playground is.
Uh-huh.
Because, in Taiwan, what I noticed is, like, if you go to a food court,
Mm-hmm.
a lot of times, I mean, there's obviously a bathroom nearby, but there's sometimes like a hand washing station.
Yeah.
I don't think I've ever seen that in the US. I don't think I've ever seen that.
Probably in the crowded mall.
No, not
No?
in the mall. Like the food courts in the mall,
Yeah.
no, they for sure they don't have it.
No,
Like,
no, no. Remember the one in Century City? They just remodeled it like a couple years ago. And in the food court, they actually have like a outside sink
oh, that's good.
just for hand washing because it's
Oh,
always packed in the bathroom, especially
yeah.
the ladies' room. So they just set up a outside sink for you to wash hands.
But it's like right outside the bathroom.
Yeah.
Yeah. But I've actually seen, you've seen like sinks in Taiwan in the food court where it's just like the sink is just right there. It's like obviously just for hand washing and it's
Really?
sometimes far from the bathroom.
Oh.
I've definitely seen that. And I've always looked at it and be like, wow, that's a really good idea.
Okay, so get back to the COVID. So I saw on the news that now Sacramento has been selected as a site for a COVID-19 vaccine trial. If approved, Pfizer and BioNTech plan to supply up to 100 million doses by the end of 2020 and approximately 1.3 billion doses by the end of 2021. We know that usually it takes several years to complete the vaccine trial. Do you think this might be realistic? Or will the situation get out of control by then?
So I mean, obviously I learned about how trials work and stuff, but I've never done one before. So I just know that it's a very extensive process, particularly in the US.
Mm-hmm.
And it usually takes a really, really long time. So I think it is good to be hopeful that a vaccine's in the near future, but I'm really worried about relying on a time frame for this to occur because, I mean, the worst case scenario is somebody really gets injured um, from the vaccine because it wasn't safe.
Mm-hmm.
Obviously, the best case scenario is nobody does. So I think it's more important that we continue what we're doing and we adapt to the changes in our lives in a reasonable way. That's more stuff that we can control and that we can be vigilant about and improve the safety and health of everybody, right?
Mm-hmm.
For example, you see that a lot of restaurants they're converting parking lots to outdoor dining. We instead of firing people, we should be coming up with ways to change their roles, so people can continue to have jobs and contribute to the economy that way. I think before, when we closed everything down, it was okay for a short period of time, but we didn't completely get rid of COVID. And so now we just need to adapt to it.
Yeah. So have you heard of Taiwan has done a really good job on preventing COVID-19?
Yeah.
Why?
I did hear about this, and I'm not one to, I'm super proud of them. So my understanding is Taiwan learned a lot from what happened back when SARS occurred. So a couple of things. The Taiwanese people were not resistant to face mask wearing or quarantines or any sort of social distancing.
Mm-hmm.
And also the government stepped in really quick to control PPE rationing and controlling the influx of the disease into the country. So obviously, Taiwan is a completely different country compared to the US, and there's a lot of factors that come into play. But to me, it's clear that the government and the Taiwanese people were very proactive and worked together. And subsequently, you have the results, is that they had barely any COVID, they did not have to close, and life is normal in Taiwan.
Mm.
And I know this because my family is there, and it's really good to know that they're doing okay.
Yeah, because I'm really impressed by how people in Taiwan have such high awareness of these issues, which they really contributed to controlling its spread.
I think it's really interesting how mask wearing became such a big part of the culture in Taiwan.
You know, some people actually wear it because they don't have makeup on. It saves time. That's true. That's true. I'm not kidding. It's true.
No, I know. And a lot of people don't, even if they don't wear it for the right reasons. It's just really amazing, like how quickly they're willing to wear a face mask.
Mm.
But this is all new, right? This is, I think I really want to say SARS is really when that change in culture occurred. But pre-SARS, you really didn't have that. And then now after that, it's like suddenly they found all these different and new ways or reasons to wear a mask.
Yeah, because I think the mask things before SARS was like what happened in US now.
Yeah.
People didn't believe it until SARS occurred. So maybe that's why when it happens, people believe what masks do.
Yeah. No, I definitely agree with that.
Yeah, I think that's the difference. Okay, thank you, Mindy, for sharing with us today. Thank you for listening, and I hope everyone stays safe and healthy. Please leave your comments on our Instagram page, or you can send me an email to let me know how you like our shows. I'm Fiona. I'll see you in the next episode very soon. Bye.
Thanks for having me. Be safe, everyone.